3D chemical cleaning of dental plaque. Welcome to Dental Vision 3D animation. In this video, you'll see how dental professionals in the United States remove plaque and tartar using advanced chemical cleaning techniques and why these procedures are essential for maintaining oral health. Plaque is a sticky film of bacteria that forms on your teeth within hours after eating or drinking. If not removed by daily brushing and flossing, plaque hardens into tartar, also known as calculus. Tartar cannot be removed at home and requires professional intervention in a dental office. In the United States, dental hygienists and dentists begin the cleaning process by thoroughly examining your teeth and gums. The first step is scaling, which involves the use of ultrasonic instruments that vibrate at high frequencies. These devices break apart and remove tartar deposits from above and below the gum line. Water is sprayed continuously during this process to wash away debris and keep the area clean. Chemical cleaning agents are then applied to target bacteria and help prevent future plaque buildup. The most common chemical used in American dental offices is chlorhexidine, an antimicrobial solution that penetrates the biofilm and disrupts bacterial colonies. Dentists may also use hydrogen, peroxide or fluoride-based gels to further clean and strengthen the teeth. For patients with gum disease or deep pockets around the teeth, a procedure called scaling and root planing is performed. This deep cleaning goes beneath the gum line, and chemical irrigants are used to flush out bacteria and toxins from these hard-to-reach areas. These solutions help reduce inflammation and promote healing of the gum tissue. After the chemical treatment, a polishing compound containing mild abrasives and fluoride is applied to the surface of the teeth. This step removes surface stains and smooths the enamel, making it more difficult for plaque to adhere in the future. The fluoride also helps to remineralize and protect the tooth enamel. The American Dental Association recommends professional cleanings every 6 months for most people in the United States. Regular chemical cleanings, combined with daily brushing and flossing at home, are the most effective way to prevent cavities, gum disease, and tooth loss. New technologies are emerging in American dentistry, including plasma jet devices and advanced antimicrobial rinses, which promise even more effective and comfortable plaque removal in the future. If you want to protect your smile and avoid more serious dental problems, schedule regular cleanings with your dentist or dental hygienist. Professional chemical cleaning is a cornerstone of modern American dental care and plays a vital role in keeping your teeth and gums healthy for life. For more 3D visualizations and clear explanations of dental procedures, subscribe to Dental Vision 3D animation. Stay informed and take charge of your oral health with the latest insights from leading dental professionals in the USA and Canada.